Hi, my name is Success. I'm a student nurse, and this is Chinelo, my colleague.
Hi.
So we'll be talking about vital signs today and what they can tell us about the patient health. Monitoring vital signs is essential in our practice and as it aligns with BCCNN professional standard, which also emphasizes on the importance of safe care and competent patient care.
Hi, my name is Chinelo. I'll be your student nurse for today. With me, I have
Success.
Okay, Success is going to be my patient for today. I'll be checking her vital signs. Okay, I'll be checking her blood pressure, her respiratory rate, her pulse rate, her oxygen saturation. Okay, and I'll be also be telling you the normal ranges of all this assessment I'm about to carry out. Okay, stay with me. I have my pen and paper to record my findings. Okay, first of all, I'll be checking her temperature. The normal range of temperature is from 36.5 to 37.5. Okay, her temperature is 36.7. It's within the normal range. I'm going to be checking her pulse rate now. The normal pulse rate is from 60 to 100. Okay, stay with me. Then I'll also be checking my time. I'm going to count for like 30 seconds and I'll multiply by 2. Her pulse rate is 40. I've multiplied by 2 is 80. So it's within the normal range. I'm going to be checking her respiratory rate. The normal respiratory rate is from 12 to 20. Okay? I'm going to identify her pulse, radial pulse. Then I'm going to pretend to be still calculating her radial pulse while I read her respiration. Okay, I don't want her to know so that she won't change the way she breathes. I want her to breathe normally. Okay, then I'm going to count for like 60 seconds, or I can count for 30 seconds and multiply by 2. Okay, thank you. Her normal respiratory rate is 40. Okay, I'm going to be checking her oxygen saturation. The normal range of oxygen saturation is from 95 to 100. Okay. Then I'll be watching the system. I'm going to check. It's 98. It's within the normal range. Then I'll be checking her blood pressure. I've already put the cuff on. And I'm going to start it on the system.
It has it already. It's what goes here then?
Her blood pressure is the normal range of blood pressure is from 120, that is the systolic, and 80 for the diastolic. Her blood pressure is 112/80. Okay, thank you.
Okay, now we are talking about the abnormal findings. The patient's temperature is 39, which means the patient has a fever, and SpO2 is 92. Blood pressure is 150/90, and heart rate is, which is a pulse, is 110. Okay, for our respiratory rate, like she has explained, the normal one, we have to look at the chest, the rise and fall of the chest, and calculate it. So it's beats per minute. So we look at every time it falls, we count 1, and we're going to be counting for 30 seconds. So we set our timer for 30 seconds and watch for the rise and fall of the chest. Okay, I can see she is rising and falling very fast, and from what I've calculated, if I multiply what I got times 2, it gives me 24, which is a bit high, and that's abnormal. And if we get abnormal findings as well, we can also redo it again to see maybe the patient is not comfortably seated or something. Then we'll do it again to get the actual one. If it's still abnormal, then we can communicate this finding to the healthcare team. We've gotten abnormal findings. First, is this a trend over this patient? Is this abnormal? Is this normal? We look at the trend first, and also in this situation, if it's abnormal, we need to assess the patient further. And according to BCCNN, based on our professional standard accountability, we are responsible for monitoring and interpreting this vital sign in order for us to provide safe and competent care to this patient.
This means that we need to inform the healthcare team about the abnormal findings of this patient, and so that we can further assess and monitor this patient for any additional symptoms. Acting quickly can prevent further deterioration.
It is important to know that BCCNN standards guide our practice as LPN and future LPN. For example, standard 2 emphasizes on the professional accountability for providing safe, competent, and ethical care. And this is part of your responsibility and also my responsibility.
Interpreting vital signs is part of your responsibility and also our responsibility
As future LPNs.
By recognizing the changes in the vital signs, we'll be able to interpret and improve the best outcome for our patients.
Monitoring and interpreting vital signs is really important for our overall health and also for early detection of any health issues. Always remember
that you will look at the readings alongside with the patient. Look at the patient so that you know whether it relates with what you are reading on the vital signs machine.
And as it is aligned in our BCCNN standard of practice for ethical care and also for the public detection.
Thank you for watching. If you have any question about vital signs, please feel free to ask us. Thank you.